All right. Good morning, everyone. I'm Larry Boris, Executive Director of the National Association of Worksite Health Centers. I want to welcome you to our monthly webinar series. Today, we're going to be talking about merger and acquisition in healthcare and the impact on worksite health centers. I'm pleased to have two wonderful, knowledgeable speakers, Stephanie Erkely from Craig Duvall and Brian Heaton, also from Craig Duvall. I'll ask them to introduce themselves and the topic for the area. The way we'll work this morning or this afternoon, depending on where you're at, is that we'll have the presentation of the organizations of the topic. Then at the very end, probably about 15 minutes to the hour, we'll then go around the table and invite you to ask questions or comments, or experiences, etc., about this particular topic. If you have a question, though, that comes up or that you brought to the meeting itself, just put it in the Q&A box or in the chat box, and we'll make sure we address that before it ends. For those of you who are not familiar, the National Association of Worksite Health Centers, NAWHC, nation's only nonprofit organization devoted solely to on-site, near-site, mobile, virtual health services for covered populations. We hope that if you're not a member already, you'll consider joining us. We provide a plethora of information and resources and programs like the one you see today to help you in creating and expanding the value of worksite health centers, providing both staff assistance and information, case studies, benchmarking surveys, etc. We have over 100 organizations, and I'll invite you to put on your calendar our upcoming annual forum, September 8th and 9th, which this year will be in Minneapolis. Next slide, please. So with that, I'll turn it over to Stephanie. Stephanie?
Hi, everyone. My name is Stephanie Eckerly. I'm a partner with the law firm of Craig Duvall and on the board of directors for the National Association of Worksite Health Centers. And so my practice really focuses on healthcare issues with a large focus on representing vendors in this space and also employers, working on everything from contracting issues to different regulatory matters such as privacy and security issues, reimbursement issues, things like that. And we have seen a large uptick in the past few years on M&A and private equity and healthcare in general, but also in the on-site clinic space. So we thought this would be a timely presentation and something a little different than what we've talked about typically with NAWHC. So Brian, do you want to introduce yourself and then I'll jump in?
Happy to do it. Hi, everybody. My name is Brian Heaton. I'm one of Stephanie's colleagues in our healthcare group, but I also chair our corporate, we call our business acquisition and securities practice group at Craig Duvall. Most of my practice involves helping people create, grow, and then ultimately exit their companies through a number of different ways and structures. And we'll talk about some of those today, but happy to join here with you all today.
Perfect. Thanks, Brian. Yeah, so before we really get into the nuts and bolts of what we're seeing, both from a trends and a legal perspective, we wanted to go over through a few case examples. All of these examples are through publicly available information through these companies' websites. So we've put some links there if you're more interested to find out about some of these, but they really focus on two different things. One, some of them involved private equity, based on publicly available information. Others really seem to be more strategic combinations to help companies grow in certain areas. So for example, I'm sure most people on this call are familiar with the Marathon Health and Our Health strategic combination that took place in around 2020. Notably, there were different health center strategies, including the Our Health's My Clinics, the network of clinics available in several markets. But their press release also said that General Atlantic, a leading global growth equity firm and existing investor in Marathon Health, was going to be the majority shareholder of the combined organization. So again, another example of where we're seeing different type of growth and equity. We had another one with Premise Health acquiring Care Here. And one of the notable things on their press release was it allowed Premise and Care Here to really grow into different areas, such as municipal and state governments, universities, and Taft-Hartley plans. So again, as Brian talks today, thinking about the different reasons for combinations and mergers, some of those being strategic growth partners. One really, I think, interesting example is Everside Health. So based on their website, it talks about the evolution in the 4 different companies that came together. So you had HealthStat and Activate, Paladina, and Our Health. So here you really see a strategic combination with 4 different players in the market. And it even talked about how in 2018, Paladina Health was acquired by New Enterprise Associates and completed a $165 million growth financing with several key investors and then other additional investors too. And eventually then all of those combined to be Everside Health. So what you see here is really a lot of different examples, and these are only a few. There's many more out there of how these combinations have impacted the marketplace and the different areas where you've seen growth due to that. Another large area that we've seen both within our own firm from the deals we've worked on and then just publicly available information is digital health mergers. So even though National Association of Worksite Health Centers, we think of our Worksite and our onsite and our near-site clinics, there's no denying that digital health and virtual primary care makes up a large portion of care now, both just within the healthcare industry and for employers. So here you have an example of different acquisitions of virtual medical care and virtual primary care that have really made a splash in the market. One of those I wanted to highlight where you see strategic areas of combination is the Amwell acquisition of Silver Cloud Health and Conversa. This one I thought was interesting because Silver Cloud delivers evidence-based and clinically validated cognitive behavioral health programs, while Conversa allows automated patient interactions after a live or virtual visit. Again, so you're seeing companies with different strengths and different places in the industry really come together. Another thing that I've seen just through my own practice is clinic operators acquiring not just other clinic operators and not just getting involved with private equity money and strategic investors, but they're actually acquiring different verticals to add to their own. So we've been involved with clinic operators that have purchased or done joint ventures with telehealth platforms and virtual provider networks. We've seen them purchase physical therapy companies. So instead of creating their own physical therapy program, they're purchasing one that already has a platform and really the workforce to go along with that. We've also seen it with data analytics companies, mental health providers, and even pharmacies and dispensaries. So those are all areas that we're seeing a lot in the Worksite Health Clinic area as far as mergers and acquisitions. So with that in mind, I'm going to turn it over to Brian to go through some of the kind of nuts and bolts of what he sees in the mergers and acquisitions.
Yep. Thanks, Stephanie. So I'm going to apologize in advance because I'm going to guess that some of you, I'll be going over things that you already know. And for some areas, I'll be talking over people's heads. So I'm going to try and find the sweet spot right in the middle. But that's what we'll get through today. And obviously happy to answer questions, as Larry said at the end. So, Stephanie's mentioned private equity a few times here. Just want to kind of go over, for a lot of people, they hear that and it's kind of a black box for what would people mean when they refer to private equity. And generally it's a pool of investment dollars, a pool of funds that an investment management company that invests in other companies. So it's a way of aggregating capital coming from different individuals, from different investment vehicles together to invest. But there's multiple ways that people will invest. And if you look at the list we have here in general, I think going down the list, you're really looking at kind of earlier stage companies to later stage companies is kind of how you go down these four types of investments. So a venture capital investment is typically for startups and younger companies. They're looking for a larger return and then an exit out from their ownership in that company to maybe another private equity firm after they've helped it grow. Growth capital, they're going to be looking more at investing in a mature company, looking to expand. A lot of times these are minority investments that are made. Mezzanine financing is typically thought of as one of the more expensive routes. It's a combination of debt and equity financing with convertible notes, with preferred equity rights, and again, a way to have a more mature company bring in additional dollars that they need to help grow and scale. And then leverage buyouts is an acquisition done through debt financing with the goal of returns that kind of outweigh the interest on the debt. So there's a lot of different shapes that private equity can take if they're looking at investment in your company or if you're looking at potential investment there. So, why is private equity interested in healthcare? Private equity is not new. There are lots of different industries that they've been in for a much longer period of time. And this is not new to healthcare, but it's certainly exploded. Why are they so interested? Frankly, there's too many factors to list, but I'll touch on a few of them. First of all, private equity firms have currently a lot of dry powder. The idea being people will give money to a private equity investment company to try and get a return. Otherwise, they could just put it in the market or do something else with it. If those dollars are sitting on the sidelines and not invested in anything, then that's not doing anyone any good. And so there's a lot of pressure to go out and find opportunities to invest, and healthcare is appetizing. There's a lot of growth opportunities in the market. This obviously we're focused on, worksite health clinics, but across healthcare, certain specialties have become more and more popular in looking at how private equity can really pull those practices or groups together and really leverage their experience. Because to the next point, healthcare is so fragmented. And when you bring all the dollars together that a private equity firm does, some of their management expertise, that can really help providers who are struggling with, economies of scale. Everyone has compliance, EHR issues, other costs. No matter your size, you have to still comply and talk to people like Stephanie and I of how you can run a good operation. And so to the extent that it's better to have the economies of scale of being bigger and spreading those costs among more revenue, that's a positive. And then much of this presentation, what I'm going to talk about is focused on physician-owned ventures, and that may not apply to everyone on the call, but there's limited succession plans for physicians in smaller groups, but really in all industries. There's a talent gap. I was at a recent presentation by a professor from the University of North Carolina talking about demographics changing nationally. And no matter where you're located, sounds like if you're in the Northeast, the last person to leave turns the lights off. But otherwise, you have people moving, you have people trying to retire earlier, and there's just not as much talent coming up from the younger ranks to be able to provide good succession planning options. So now what we have now is with those generational differences and things like that, some additional options for private equity to come in and be the savior for someone who's looking for a soft landing for their practice or for their business. So, do want to talk a little bit about, the difference between private equity and a strategic investment. So Stephanie mentioned kind of some of the different transactions that have happened. Some that have been more PE focused, some that have been more strategic. These are broad, gross generalizations. So not all one size fits all, but for private equity, usually there's a lot of capital available, obviously to do the transaction, but then also for additional growth afterwards. That's attractive. Typically, these PE firms are bringing a lot of resources and connections and management experience. They can come in if you're having difficulty recruiting or talent in a certain area. You need a stronger CFO. There's all sorts of options there. And one of the attractive things that private equity can bring in a transaction that you're considering is there can be very little change to operations. And so the thought is, if I go with a strategic partner, they're going to have more say and want me to change some ways that we have done business historically. A private equity firm may have less thoughts on what's the best way to do things and maybe let me keep a little bit more of my day-to-day. I would say that's evolved over time. The more that you get private equity firms that have gotten experience in healthcare, they have more of a thought on how things should be run. So as part of a negotiation, more and more, we're really having to fight for representing the seller on the side of retaining certain controls to really keep the essence of who you are in the services you're providing and how you treat your employees. So that's something that is evolved, but I still think in general, most people think that a private equity investment is going to be a little more passive in your day-to-day than a strategic investment. Strategic investors, obviously, they may have more healthcare experience. It could affect your daily operations, but they could also speak your same language. And that I've seen some frustrations when people have sold to private equity or brought in outside money where there could be some tone deafness to what they're trying to do and how a certain change might impact operations or might affect bottom line. And really, a strategic investor has likely been through those situations. I will say, I'm seeing more premium placed on people who have been through COVID themselves and have battled through what that did operationally for the business, because sometimes when people come into an investment and they didn't live through COVID as part of operating a healthcare facility, through COVID, they really can kind of have a better feel if they've been through those wars than now. So something to consider. Vertical integration, and I specifically noted provider payer relationships. If you think of, Optum acquiring, different practices, but vertical integration and some of the things that Stephanie mentioned in some of the deals, there couldn't be people at different levels of the spectrum in terms of the service that's provided, different parts of the chain, and can really create some economies there if you have that integration. And then last, I think that, maybe one of the more positives that people see on a strategic investment is a lot of times they're a longer hold. So a private equity investor typically is going to have a fund that invests in the practice or in your company, and they are only going to have that fund in place based on its creation for a number of years. And so after maybe a 3 to 5 to 7 year period, they're ready to move on, and they've got to find a new landing spot for their different investments because they're going to cash out the fund. And so that can be unsettling for people who are looking for more of a long-term transition plan. And there's plenty of companies out there that have been on their second, third private equity sponsor, but a strategic investor may be looking for more of a long-term hold. And if that is appealing to you as a seller, then that can have some real upside. Talk about due diligence a little bit. So again, this slide is really more from a sell side perspective. As a buyer, if you're going to buy another company, I don't think we have any PE firms on the call, but if we have, people who are out here to looking at being a buyer in a strategic investment, you have plenty of diligence you'll want to do on your target. And, that's where it's important to get legal counsel involved and other advisors involved early to see what kinds of questions should I be asking to protect the value of what you're investing in. But from a sell side perspective, it's also important to note that most of these investments involve some amount of continued risk and involvement in the business. Most of the time when we do these transactions, the current people running the business are not just stepping away, moving to Bora Bora and counting their cash. They're continuing to be involved. So you want to know the diligence that you have that you should do on the person who's looking to acquire you. And so I mentioned a couple of these things. One of the key upsides for looking at these investments is access to capital for growth and additional resources. Ask for concrete examples of talk about prior acquisitions that they've done. Give me concrete examples of where you're able to deploy your additional capital to help operations, help patients, help employees. Ask about what their prior healthcare experience is and what do they really know about your business. Ask about their experience and their goals with their liquidity events. If you are early stage in the fund, you might be able to have them be your owner for 7 to 10 years, and that might be enough where you say that's great. Those funds are going to continue to make investments all the way up towards the end of their useful life. So if they're a year away from selling and you're the last cog before they sell, you might want to know that up front. Again, management style, are they more passive? Are they more hands-on? And then obviously feedback from their current and their past partners. And I put a focus on their past partners because it's really easy for someone who's looking to make an acquisition to put, when you fill out a reference list on your resume, you only list the people that really are going to talk well about you, right? And so I always want to know, is there anyone who didn't do the transaction? Is there anyone who did the transaction and then didn't stay? And those are the people you want to talk to. Those are the people that are going to give you the best resources for you to ask some really pointed questions. And they may not give you a lot, but any amount of information you get is better than nothing. And just in general, culture is a word that's thrown out. When we're talking about our firm and we're looking at bringing on lawyers, we talk about our culture. It's important to us. And I know it's kind of a buzzword that's out there, but it really does matter. What will they require of your employees? How can you help to be, a place where people are going to want to come and work and continue to work pre-transaction, obviously, and post-transaction? And how is that going to look? Because it's recruitment and retention is just a very difficult thing these days, no matter what industry you're in. And so those questions of culture overall are very important. I won't mention rep and warranty insurance in much more detail, and then to say when you're doing diligence and you're looking at a potential transaction, representations and warranty insurance is becoming more and more prevalent. It's something, if you are sell side, a buyer should be offering to consider whether they obtain one of those policies, how you split the cost of that and the retention is a point for negotiation, but those policies are becoming more and more available. They're becoming more cost effective than they were, at least originally. There will be carve outs to them, but it can be a powerful tool if you're weighing offers to know that a rep and warranty insurance policy is out there to protect you. As far as legal and regulatory issues, when these types of investments or acquisitions are happening, I will admit I'm an Indiana boy, and so some of these may be colored by what we have here. But when we're working on these transactions all over the country, we're always checking local listings, I guess I would say, for what your states have for specific rules. But a lot of them fall under the same general umbrellas of rules that we have to consider. So certificate of need or other government consents, if you're doing a transaction, making sure that there's nothing needed there. Corporate practice of medicine and fee splitting. This is probably the biggest that drives the structure of these transactions. And I'll go into this a little bit more detail here in a minute. But in general, these laws are focused on making sure that professional judgment of physicians and practitioners is not impacted, making sure that non-providers cannot share in those fees. Different states have different focus on this. Some are more hyper aggressive and really have very strict, clear rules. Others are a little more lax, or maybe they have a clear rule, but they've never enforced it in their life. So that's just where it's important to have someone who can come in and help you through those issues, because it can impact the structure of the deal and making sure that everything's done from in a compliant way. Valuations also very important. There in a lot of these transactions, it's not as simple as just one transaction document, what gets paid. They'll end up with post-closing arrangements and relationships. And you want to make sure that the valuation is supportable from a compliance standpoint. And to the extent that the valuation impacts the financial deal, I can guarantee you the buyer will have the valuation performed on their end. Query whether you want to have someone yourself have an independent review for valuation of your practice or your operations to make sure that you're getting a good deal. I also, always think it's a great idea when you're looking at the value that's provided. These agreements will make your head spin. There'll be different formulas for how different payments are made. It's really helpful to go through a detailed review and say, okay, let's model out what these payments will look like in the future, so that okay, let's base it off of our last 2 months of financial performance. How will this look post-closing? It's really easy to throw out a lot of different payment structures, but if you don't understand how that's actually going to look based on your past results, you can set yourself up for failure and for some heartburn there. Licensure is always very important. Obviously, making sure that you can get the licensure you need as of the closing. Almost always with these transactions, we're seeing a signing of the transaction and then a closing at a later date to make sure things that like licensure and credentialing and payer contracting can be done. Obviously, there are some licenses that can't be transferred or may have change of control provisions, so you have to check with those as well. Medicare and Medicaid, if you're enrolled in those programs, you may have change of information or change of ownership filings, depending on the state, depending on where you are. But obviously for Medicare, you would for a change of information. And then state securities laws as well. There may be different requirements for notice. I'm not going to get into that specifically because it just varies so much all over the place. But these are just a few of the things to keep in mind that your counsel will cover with you. But it's a long way of saying there's a lot of hoops to jump through when you're talking about M&A in the healthcare space that you may not have as an industry that's not quite as unregulated as healthcare is. As far as ownership and capital structure, PE investments, again, are not as straightforward as just a direct investment of the company based on the rules that I just went over. And so a lot of times the way that this is done for PE investment, if you have a strategic investor who's already licensed, you have all those things covered, you're not going to have some of these issues. But these are some of the nuances that we're working through that I'll try to cover. Is that the PE investment is going to be made through a management services organization or an MSO. What happens here is this addresses your corporate practice of medicine, fee splitting, and some of the other concerns I mentioned. And the PE firm will create this MSO to provide services that are non-clinical in nature. Things like billing, collection, providing equipment, leasing and space, non-clinical personnel, budgeting, although that's a key issue when you're talking about maintaining control. Budgeting is key there. Contracting, possibly advertising. Again, that can change based on local laws, but those are the types of services that the MSO will provide. And then, we're going to go through some of these models for structuring an MSO arrangement, 3 different kind of arrangements here. And that's how the PE firm can make the investment to allow for them to participate financially while still being compliant with some of the things we've talked about. So this first model is more of an independent practice model. In almost all of these scenarios, I believe all the scenarios, the management company, which is newly created, purchases the non-clinical assets of the practice. So if you think about that, you'll have a list of what contracts, what other assets are not clinical in nature that do not need to stay in the practicing entity that's licensed and providing the medical care. Under this model, that management company and the practice that exists, or the company, and I'm just going to keep saying practice, they enter into a long-term management agreement, in which case the management company manages the practice for a fee. What that fee looks like can differ, but generally you have a fixed amount of fee that's negotiated no matter what. That a dollar amount is paid no matter what. But then also you would have a dollar amount that's paid based on a percentage of the practice's incremental profits, and that would be negotiated by the parties. And this goes back to why it's important to have valuation and professional advisors. So generally speaking, having that fixed fee is fine. Having a percentage of incremental profits can be fine, because you can imagine that the larger someone's their business grows, the larger the profit in terms of from their operations, there's probably more management services that were needed, and also there's efficiencies in driving profitability. So some reasonable amount that someone gets paid based on profit can be justified. The issue that you have is if it takes too much of the funds away from the practice going to the management company, where they're being paid above fair market value for their services, or that markup is not reasonable, that's where we can get into compliance issues. So fixed amount would be fine. A payment with some profit built in. You could use certain expenses or charged at cost with a reasonable markup. Again, all of these options are on the table and can be negotiated. And depending on who your suitor is, they might have models that they like better than others. In this transaction, actually, Steph, if you can go back, the one thing I'll mention is that the physicians who are still owners, or in the practice, they can also become owners in the management company as well. And so in this scenario, I have question marks there whether they're going to participate or not. That can depend on the deal. And so if you're looking at this as a potential seller, it's an interesting thing to consider. What am I going to get on the front end for the transaction? But also, do I have upside long-term in terms of being an owner of that management company? And how is that management company going to be used in the future? Is it going to be just a management company for this particular operation, or is it going to be leveraged for other investments made in the future? And then the last thing I'll say here is I'm going to talk about some restrictions on physician ownership moving forward. Here, this really allows the physicians to stay the owners of the practice, but the protection that the PE firm gets is through the long-term nature of the management agreement. And it will not just have a 90-day out where you can get out without cause upon 90 days. So that's the independent practice model. I would say, generally speaking, that is a little less common. It's a lighter touch because it doesn't get the PE firm's claws into the practice as much. And so that's kind of the soft version of this. We can go to the next one. It's called the friendly PC model. So again, you've got the management company purchasing the non-clinical assets of the practice. And then you've got the management company entering into the management agreement for a fee. So that's the same. What we have here, though, is that the physicians largely give up their ownership, or it's transferred to what's referred to a friendly physician. You hear friendly PC. And there's a stock transfer agreement that's entered into with the management company. And effectively, that acts as a limitation and almost like a pledge agreement on the rights of the owner. So the management company controls who the physician is. It keeps that person friendly to them, has a number of triggering events that doesn't allow transfer. And basically, this will be a way for the management company to control ownership of who is truly in the practice. And the physicians then, when they're through, they're part of the practice, they're now compensated. All your providers, whether they were owners before, are now only employees. They'll have an employment agreement that says how they are paid. And that's really, their way of getting paid. There's no upside financially through having ownership in the practice anymore. And then, go ahead.
I was going to say, this is a model we see a lot with worksite health clinics too. So nationally, especially some of the larger players, that may be operating in multiple states, there's different corporate practice of medicine statutes. So whether we're involved in an acquisition or just helping with entity formation, right, we will see a lot of the worksite centers have the management company over top, then with the friendly PCs in different states. So this is not uncommon at all in this industry.
Yep. And then the last model here that we have is more of a hybrid model. Again, this is similar, that allows for acquisitions by the parent management company in the future, while limiting kind of the overall practice participation, the upside to this particular practice. So, the physician had ownership in the management company before. Here, if there's a specific practice management company for each individual clinic or practice that's acquired, it allows for there to be more financial alignment with the physicians with that spot, but the ownership of the overall of the management companies may be at a higher level that allows for the PE fund to have a little more say and not necessarily share participation in future ventures with the physician. So it's just important to understand going in, if you're looking at selling, what is my, obviously it's important to know what the transaction is up front, but in terms of rights that you have moving forward in the future, where am I going to be participating and at what level? Move away from fun pictures and back into legal land here, which can be painful, but just an overview of some of the key documents that are out there that are really important as part of the transaction. First and foremost, having a non-disclosure agreement in place before you would share any information, making sure that there's a non-disclosure agreement there that's going to protect you. Again, something I'll point out that's really becoming more and more critically important is I'm increasingly seeing non-solicitation provisions included in non-disclosure agreements when we talk about this. If you're going to allow people to dig in and find out more about who you are and your team, you want to protect that they're not going to turn around and find out, what you've been paying people and then turn around and try and hire your people away. So if I'm on the sell side and I'm doing a non-disclosure agreement, I would like a non-solicitation provision for the right for people to learn a little bit more about your business, because people are just so valuable these days. Letters of intent. So you sometimes hear this as an indication interest or a term sheet. Some deals get done without a letter of intent. Healthcare, private equity, or deals like this should not be one of them. You will want a letter of intent before you start really digging in to make sure that you know that there's actually a deal that's viable and to be had. You have a lot to cover in there. You want to know what the entire deal is going to look like, from what your ownership interest will be moving forward, what control you will have, governance models, and especially because depending on who you have involved in the sale and where they are in the stage of their life, you have different people who will prefer more cash up front. People maybe prefer long-term upside. It's just way better to go into this process with eyes wide open to make sure that you actually have a transaction before you do a bunch of diligence, spend a bunch of money on lawyers. So take the time to make sure there's an LOI in place. And if they're not recommending one, which I can't imagine that would be the case, make sure that happens. We could do it.
Can I say something else about an LOI, just from some deals we've been involved into? If you have legal counsel, that is the time to get legal counsel involved. One thing we've seen, and it happens honestly every single year in deals Brian and I work on, is that people come to us after the LOI is already signed. They may have not understood all the terms, especially if it's a private equity deal, because it can be really, really complex, even the LOIs can. And then they want to renegotiate it. And it's really hard to come in after the LOI has been signed and try to change a lot of those business terms that everyone is moving forward under. So I know people, I've seen them, I want to save money, I'm just going to do the LOI myself, then pull in legal counsel. I think you're actually going to save money and time by really starting working with your advisors, and not just legal counsel, accountants too, financial advisors, at the LOI stage as opposed to afterwards.
Yep. Agree completely. The purchase agreement, we could do an entire presentation on that. This will be the main document for what the representations and warranties you make. Again, from a sell side hat, perspective, this is really making sure you try as much as possible to limit the promises you're making about the business to what you really know, because the buyer is going to try and put some pressure on that and want you to essentially guarantee some things that you may not even be able to wrap your head around on compliance and other issues. I would say hot button issues from a rep and warranty perspective these days, compliance in general, coding and billing audits, HIPAA compliance is really important. There's been an increased focus on kind of with the Me Too movement and looking at, have you had any employee claims or issues in that department? So those areas are getting more and more scrutiny. If you're looking at getting rep and warranty insurance, those will absolutely be reviewed in great detail. Reimbursements, another area. I will actually share a war story. I was about a month ago, we were on the doorstep of signing a transaction up, and Anthem came out with a notice that they were considering a change in reimbursement for a particular procedure that one of the sellers was one of their main services, and it actually cratered the entire deal. We were a day away from signing, and that would have drastically changed the financial models. The parties are trying to regroup and see whether they can come up with a different structure, but you have to be digging into these things always up to the bitter end. There's also disclosure schedules that go along with a purchase agreement. Those schedules will be your opportunity to tell the list of your good, your bad, and your ugly. And again, just important to have counsel involved to really to share through and work through these issues in the agreement. So the management agreement, again, this will be the main agreement between the MSO and the provided practice entity or the clinic that provides what the services are going to be provided. At the end of the day, you just want to make sure that those services don't interfere with your timing and ability to make professional judgment, and that it's really supportive and not something that's getting in the way. Employment and services agreements, these are really just as important as the purchase agreement for people. If you're selling, but then you're going to continue to work there for a long time, you want to make sure that agreement is something that you can live up to. And so sometimes when we do these transactions, the buyer will say, oh, we'll get to the employment agreement later. No, that needs to be addressed in the letter of intent. You need to know upfront, what is the level of workload expected? What kind of time off are we going to be allowed? Did I have any perks before I'm not going to get? What's going to happen with benefits? And obviously how, your termination rights as far as cause and good reason look, to make sure that you really can be an employee there as long as you want, and there's no kind of gotchas that would be a bad situation. So that document will spend a lot of time. I would say the purchase agreement is probably the most heavily negotiated, but the employment and other services agreement are important as well. And then operating agreements or bylaws. So if you end up getting ownership in the management company, or some kind of other venture as part of the deal here, as some rollover equity or something like that, I will tell you in most cases, these documents are not negotiable, but you will want to understand what they mean. And at a minimum, you're going to want to make sure if they're a pass-through entity, that there is contemplation that you'll be paid dividends or distributions for tax purposes to cover any pass-through tax, because most of the time for private equity, they just want to reinvest in the company to grow it as much as possible. They're not really interested in short-term distributions and payouts to the owners. So that's a different mentality that you need to understand. And then I mentioned the stock transfer agreement previously. If you do have a friendly PC model, you'll have restrictive covenant issues throughout all these agreements. It's important to look at those and how those work together and stack, and the different scenarios where those will apply. In most cases, you're going to have a non-compete no matter what for a period of at least 3 years, sometimes up to 7 years. And that would apply even if you were able to get out of your employment arrangement and they didn't do something right. So a lot of things to consider, a lot of documents, a lot of paper, and that'll make your head spin. But these are just some of the different key documents that go along the way in doing a transaction. So I think, Stephanie, back to you here.
Yeah, thanks, Brian. So, Brian talked a little bit about the reverse due diligence. If you're on the sell side and you're looking at bringing on a private equity partner, what you want to do. But we want to spend a little more time talking about the due diligence that will be done on you if you are the seller, or if you're an on-site clinic company wanting to acquire another on-site clinic company, some of the things you should be looking at. This list is very abbreviated. These lists are usually pages long, with lots and lots of bullet points underneath. So, one thing I always talk to my clients about, if you are wanting to prepare to sell, whether it's sell outright or bring on a private equity partner, be prepared for the diligence and start getting organized now, right? Have a contract management system, Know if your audited financials and what those are. Have a clean up your cap table. Think about what litigation you may have. Do you want to settle any of that litigation if you know that you're going to be in a sell side mode? So these are some of the things that you should expect. One thing that's a little different that I see with on-site clinics more than I do probably other industries within healthcare is the broker, consultant, and commission disclosures. You know, a lot of the worksite health centers and employers work with various brokers and consultants, and there may be commissions there, but also sales commissions for internal sales, right? And those are something that are really important to keep track of. Think about what the tail on those is, right? Because that will all be part of your disclosure schedules too. So those are going to be really, really critical. Thinking about, you know, the impact on employers is the other thing I want to take a few minutes and talk about here. So we're going to have a more detailed webinar on the operational aspects when there is a transition of vendors. But here I want to think about if there's any employers on this webinar, you know, what should they be thinking about if they're working with a clinic manager that is undergoing a transaction, whether it's a merger or some type of other strategic combination. But also for those clinic managers and on-site, you know, worksite health centers on the call, on the webinar, what should you be thinking about for your employer clients? Because, you know, you want this to be seamless for your employers. You don't want them to, one, it'd be best if they don't notice any transition potentially, but if they do, you want it to be something where they see the opportunities for new platforms, new things, and make it easy. So one thing to think about is your assignability of contracts. So you're going to have a clinic management agreement or some similar agreement with an employer or vice versa with the worksite health center. And so one thing is, right, can the worksite health center clinic manager assign that to a new entity if there's an asset sale? If there's a change in control, do they have to get your consent? Does that trigger an assignment consent? Or do you just get notice of it? We've also seen sometimes after deals where the new manager or the new kind of strategic combination want to negotiate new contracts. Not as common, but we've seen it happen occasionally. So just thinking about that, you know, again, that's going to be important if you're on the sell side or the buy side, and if you're an employer. One of the other things is just the marketing and the patient-facing issues. So post-closing, is the worksite health center keeping the same name, the same branding? Typically they will, at least for some period afterwards, but will there be new websites your employees have to go to? Are there new patient portals that they have to log into? Maybe they're forced to use a new patient portal if there's been a change to an EHR, if you've got two worksite health centers coming together that were both using different EHRs. Or maybe it's a new virtual platform that they have the option to. So again, there's really neat opportunities sometimes when you have a merger or acquisition like this, but you just need to think about the impact on the clients and their employees and really get out in front of that instead of having it be a mad rush at closing. Do you need new intake and enrollment forms? Again, something to get in front of. Another thing that I end up getting a lot involved in a lot on the regulatory side is the impact on supplies and pharmaceuticals. So in some states, there are wholesale distribution drug laws that prohibit the sale of drugs, let's say from one healthcare company to a second healthcare company. And so if you have an asset deal, right, where you're having assets being transferred, those drugs may not be able to be transferred from Worksite Health Center A to Worksite Health Center B. And that's the same when you're transitioning clinic vendors. We'll talk about that more at another time. But, you know, can those pharmaceuticals be transferred? And if not, how is that reconciled from the employer from a cost perspective? Will there be changes in patient care, how refills are handled? All those things are really critical. Another thing that we always think about when we talk about the impact on the employer and their patients, employees, is the transition of key personnel and vendors. So will your clinic operations manager stay the same? And if not, you know, that's fine, but making sure you're having those transition meetings, again, well in advance or taking some time post-closing to do that. Another really big issue is, will the provider staff stay the same? As Brian mentioned, workforce is a huge issue, especially within healthcare, whether it's physicians, nurses, or medical assistants. Everyone is looking for workforce. So ensuring that in any acquisition or strategic combination, you have a really good plan in place to take care of those employees and make them feel valued through that. And like Brian said, keeping the same culture is going to be really critical. The last thing that we see sometimes is If there's a merger or acquisition, we'll see a change in vendors the Worksite Health Center works with, which can be disruptive to the employer and patient, right? So are they going to be working with the same PBM, mail order pharmacy, the same virtual care platform? So just thinking through those issues is really critical. And then the last two things I want to talk about are really go hand in hand, the transition of software and platforms, and then privacy and security and data sharing. So will the surviving entity be using the same analytical dashboard? I know some employers can log in and see things like that, you know, or the same telehealth software. And then the last thing is privacy and security. So as we're working with both employers and worksite health centers, one of the really critical things that we're doing is doing a really careful vetting of anyone who is going to be handling medical data. So whether the worksite health center or EHR company is going to be storing that in Azure, a cloud, or in a data warehouse, you know, what are those privacy and security requirements? Does that worksite health center, the EHR company, have a SOC 2 certification or high trust CSF? And how's that handled through any merger, you know, or acquisition? So what I mean by that is, you know, is the surviving entity, if it's going to be different at all, going to have those same security certifications that your CSO, you know, signed off on when you originally negotiated that deal? Do you need new business associate agreements or data sharing agreements, especially with all the data sharing we see in this industry? So just all those things to think about. And I'd really encourage, you know, if you're on the employer side, be thinking about this, but even more so on the worksite health center side, that you're thinking through these issues to make it a smooth transition for your client. So your employer client is not having to worry about all these as much. And that is it. So Larry, I'll turn it back over to you for questions and comments.